Joining us now is Dr. Bedsole. He is an internal medicine physician with Flowers Hospital here in Wdhn. Dr. Bedsole, thank you so much for being with us today. You hold a weekly Facebook show on your personal page and give an update on the current conditions of the pandemic. Can you give me a brief COVID-19 update and tell me what you expect after this holiday week?
Thank you for having me. It's a pleasure to be here. Yes, we host a show once a week on the recent developments of COVID-19. I am concerned as we head into Thanksgiving. The virus is spiking all around us, especially in the Midwest, but even here in the Sun Belt. Cases are as high as they've ever been. Hospitalizations are high. The death rate, thank goodness, is lagging at this point, but I would say, as other epidemiologists across the country have said, we're sort of like a house on fire right now. So I am worried about the next 3 to 4 weeks until Christmas. If we don't, as we've said before, bend the curve, we could see, some people think, 250 or 300,000 cases a day by the turn of the year, which would just be unbelievable. So we're in about the worst situation we've been as a country right now as far as the numbers, unfortunately. I wish there were better news, but.
And earlier you mentioned, we don't know what the death rate is going to be or if it'll continue, but one death is, one too many. But how many deaths are expected in Alabama, and how many have we had up to this point?
We've unfortunately had a lot of death in the state. We're approaching, or the last figures that I had, I think we're somewhere close to 3,000 deaths, roughly. Some of the models suggest that we're going to go to 6,500 deaths by January, February, depending on which model you read. The country's numbers, as you know, are now well north of 250,000, and some of the models indicate the country itself is headed for 360 to 400,000. But, it's an awful number to think about, both locally in our state and nationally, but to think that there could be 6,000 to 7,000 Alabamians who lost their lives, with this pandemic, as I've said on our live cast before, to me, that's just a sobering number. It just really makes you take pause. But hopefully that won't happen if we can do our part. And I know the vaccines are coming, but the predictions aren't great at this point.
And we now have more information about the COVID vaccines from Moderna and Pfizer. Will Flowers Hospital be receiving these vaccines once they are available and distributed? And when will that be, if possible?
I don't know. Yeah, I think all the local hospitals will. I can't speak specifically for Flowers. I believe we will at some point, and I know the administration will have the information on that. I think all the local hospitals throughout the state, actually, I know the Alabama Department of Public Health has a plan for distribution for Pfizer, Moderna, and whatever other vaccine candidates are down the pike. That's being worked on, I think, actively. I would hope, and this is just my personal hope, that we would have some access to vaccine perhaps in January, February. So I've said before, and I've told my family and friends, I think light is coming. Maybe this is not the end, but it's the end of the beginning. So if we can all just keep each other safe, I do think the vaccines will be here in a matter of weeks, and that won't stop things immediately, but at least that will begin to turn the tide. And to be honest, for the first time in a long time, I think we have some hope.
Well, Dr. Bedsole, thank you so much for joining us today. I really appreciate your time and everything you and other healthcare professionals are doing to keep the community safe and healthy.
Thank you very much. Be safe.
Thank you. Dr. Bedsole says it's important to remember to thank those on the front lines now more than ever as the numbers continue to spike. Doctors, nurses, and all medical employees are starting to feel burnt out, and a simple thank you can go a long way.